Hi, I'm Dr. Chad Duplantis, restorative dentist from Fort Worth, Texas, and today I'd like to provide an expert tip on magnification. In dentistry, we have so many checklists in order for us to become proficient at what we do, especially in restorative dentistry, but it's no different in surgery. When I think of checklists after the diagnostic procedures I've gone through in my practice and I'm actually getting ready to perform a procedure on a patient, I like to think of it as the VIP protocol: visualization, isolation, and preparation. Most importantly of those three is visualization. I want to be able to visualize, obviously, what I'm working on, otherwise it's not going to be a good scenario at the end. But with visualization, I not only want to be able to visualize it, I want to be able to visualize it better than the naked eye allows me to. So that's where magnification comes into play. By proper utilization of magnification in our practice, we can adequately visualize what we need to and work on what we need to and take the adjacent teeth into consideration as well. However, magnification is not only important in your restorative dentistry, it's important for your health as well. There's been a recent study that showed that up to 2/3 of dentists are forced into early retirement due to musculoskeletal disorders. Where magnification plays a role is it allows us to work on those patients at an appropriate distance without placing the unnecessary stress or strain on our neck, on our shoulders, on our head, and allows us to practice longer into our careers. With magnification, though, there's some things that we need to look for. One of the things we need to look for is what magnification do we need? Do we need 2 times, 2.5 times, 3, 3.5, 4, 4.5, and that's dependent upon you. You should try out the magnification, see what magnification works for you, and make sure that it doesn't strain your eyes initially while you're working on it. You will get used to it. Some of that's common, but some of it's not. Secondly, you want to look at the field of view. You want to make sure that you can obviously see what you intend upon working on, but you also want to be able to take the adjacent teeth into consideration as well while you're working. Thirdly, you want to look at what they call the angle of declination, which means the angle at which you are looking down upon that patient. And by utilizing that angle of declination along with the focal range, you will be able to properly visualize without placing that undue stress or strain on your head and neck and shoulder region. And finally, you want to make sure that you buy magnification with illumination so that you can not only properly visualize, but you have adequate light to see what you're working on. A great pair of loops that I've been utilizing for the past several years are the Q-Optics Prismatics. They're lightweight, they have a great range, a great angle of declination, they have illumination features available, and the focal view is the best I've seen out of any of the loops that I've worn in the past. So the moral of the story is that magnification improves our dentistry, and our patients deserve the best that they can get, and the only way for us to get there is by utilizing proper magnification. Thank you very much.